For the following forearm films, we're gonna be using one cassette, 12 by 17, and we're gonna have two views on it. And we're gonna have a SID of 40 inches and a left marker. For AP forearm, we're gonna ask the patient to supinate their forearm, elbow extended, or across the diagonal axis of the image receptor to include the joint close to the trauma. It's a line through the humeral epicondyle is parallel to the image receptor. The center ray will be directly perpendicular to the midpoint of the film. For lateral forearm, we're gonna ask the patient shoulder positioning so that the humeral and shoulder are parallel to the table with the forearm. The elbow is flexed 90 degrees, then hand, wrist, and forearm are rotated to line a true lateral position resting on the ulnar surface, aligned to the humeral epicondyle and perpendicular to the film plane. The center ray will be directly perpendicular to the midpoint of the film. For the following elbow films, we're gonna be using two cassettes 10 by 12, and we're gonna have two views per cassette. We're gonna have a left marker, and the SID is 40 inches. For an AP elbow, we're gonna have the hand supinated and extend the elbow. Hand must be supinated to prevent rotation of the radio and ulna. The center of the elbow joint to be center of the film and a line through the humeral epicondyle is parallel to the plane. The center ray is directly perpendicular to the elbow joint. For medial oblique elbow internal, we're gonna start with the arm extended, palm supinated, and then pronate the hand. Then, the center of the elbow joint is centered to the film. A line through the humeral epicondyle will form a 45-degree angle with the film plane. The center ray will be perpendicular to the center of the elbow joint through the center of the film space. Lateral oblique elbow. Extend the elbow and center it to the center of the film. Externally rotate the hand and arm so that they align through the humeral epicondyle form a 40 to 45 degree angle with the film plane. The center ray will be perpendicular to the midpoint of the elbow to the center of the film. For lateral elbow, the patient is seated with the elbow flexed 90 degrees. The shoulder is dropped in order to maintain a parallel relationship between the plane of the film of the humerus and forearm. The forearm and wrist is lateral. This should place a line through the humeral epicondyle perpendicular to the film plate. The center ray will be directly perpendicular to the midpoint of the elbow joint through the center of the film space. For the elbow joints, we're gonna ask the patient to be seated with the elbow flexed with the first fist resting on the shoulder. The center ray will be perpendicular to the humerus, approximately 2 inches superior to the olecranon process through the center of the receptor space. For the elbow acute flexion position and ulnar sulcus, we're gonna have the patient seated with the elbow flexed with the forearm resting on the image receptor. The central ray will be perpendicular to the humerus, approximately 2 inches superior to the olecranon process, through the center of the film receptor space. For elbow Holly method special examination, patient cannot extend the elbow. Then the distal humerus is parallel to the film, centering the condyloid area of the humerus. It may be necessary to provide a support for the patient forearm The proximal radius and ulna is dorsal surface of the forearm on the film centering to the elbow joint. The center ray will be directly perpendicular to the elbow. For collateral view, we're gonna have the patient seated with elbow flexed 90 degrees. Shoulders supposed to be dropped in order to maintain a parallel relationship between the plane of the film and the humeral and forearm. The forearm of the wrist will be pronate P2A. And the center ray will be on the joint of the elbow joint. For the next humerus views, we're gonna have a cassette of 14 by 17, a left marker, and a SID of 40 inches. For AP humerus, we're gonna have the patient supine and upright and arm extended. The plane should be at the elbow, abduct the arm slightly and supinate the hand. The center ray will be at the midpoint of the humerus. For lateral humerus, we want to have the patient supine, upright with the arm extended, shoulder in the same plane as the elbow, and internally rotate the arm. The center ray is on the mid-humerus. For proximal humerus, we're going to be using a 10 by 12 cassette, and we're going to have the patient centered to the center ray of the coracoid process, then use it to center the films. The patient will be resting the palm against the thigh, and this position will put in place the epicondyle of the humerus at 45-degree angle to the plane of the film. The center ray will be perpendicular to the coracoid process through the center ray of the film.